Have you ever really stopped to think about what's happening inside your body when you get a cut, or even just catch a cold? I mean, we see the end result, right? The scab, the cough. But that's the final chapter of the story. Today, we're going to rewind all the way back to the very beginning, to chapter 1, to a single microscopic event where every single disease gets its start.
So let me ask you this. What could a vitamin deficiency possibly have in common with, say, a physical wound, like a scraped knee, or a bacterial infection with a chemical burn? I mean, on the surface, they seem like they're from completely different planets, don't they? But the truth is, deep down at the most fundamental level, they all trigger the exact same alarm bell inside the body. They all start their fight in the very same tiny arena.
And there's your answer, the cell. Every disease, every injury, every single thing that goes wrong in the body begins with damage to one single cell. It is the universal battleground. So if you can understand what happens to that first cell, you can understand the entire chain reaction that follows. So let's follow that chain. Our story kicks off right at the moment of impact, resuming in on the very first casualty of war, the injured cell.
So what do we even mean by cell injury? Well, think of your body as this huge, bustling city. And every cell is a specialized building, a power plant, a factory, a library, each with a specific job. Cell injury, then, is basically like a sudden power outage in one of those buildings. The lights flicker out, the machinery grinds to a halt, and its normal work just stops.
Now, this is where things get really interesting, because that cell now faces a critical fork in the road. If the damage is kinda mild or doesn't last too long, the power can be restored. That's what we call a reversible injury. But if the damage is too severe or goes on for too long, that building is condemned. It passes a point of no return, and the injury becomes irreversible. The entire fate of that cell is hanging right there in the balance. So, what kind of things can cause this damage? Well, the list is pretty long, but it all boils down to a few main culprits. You've got your physical or kinetic injuries, things like a cut or a burn. Then there's chemical exposure from toxins or those notorious free radicals. Then you've got deprivation, literally starving the cell of things it needs to survive, like oxygen or nutrients. And finally, sometimes the attack comes from within, like our own immune system going haywire or a genetic defect. So many different paths, all leading to that same initial power outage in the cell. Okay, let's move on. What happens when that power outage isn't temporary? What happens when the building is officially condemned and abandoned? Well, we've just crossed the point of no return. When a cell dies because of that irreversible injury, we get something called necrosis. Now, here's a crucial point. Necrosis isn't the moment of death itself. Think of it as the evidence left behind after death. It's the microscopic rubble you see after the building has already collapsed. And get this, these changes, this rubble, usually don't even show up under a microscope for another 12 to 18 hours. A huge part of necrosis is watching the cell's command center, the nucleus, just fall apart. It happens in 3 very distinct acts, like a tragedy on a tiny stage. First, in a process called pycnosis, the nucleus shrinks up into a dark, dense little ball. Then comes karyorexis, where that ball literally shatters into pieces. And finally, in karyolysis, those fragments completely dissolve and vanish, like they were never even there. It's so distinct: shrink, shatter, and dissolve. Okay, so that's the microscopic drama. But what does this look like in the real world, to our own eyes? Well, necrotic, or dead tissue, has a few telltale signs. It loses its color, usually looking much paler. It loses its strength, becoming soft, kind of fragile. And if bacteria decide to move into that abandoned site, it can start to develop some pretty foul odors. And it turns out, not all rubble looks the same. Depending on the tissue and what caused the cell's death, necrosis can show up in different ways. For instance, with coagulation necrosis, something you'd see after a heart attack, the tissue actually gets firm, and you can still see the ghostly outlines of where the cells used to be. But with liquefactive necrosis, which is common in the brain or in big infections, the tissue just dissolves into a liquid goo. Different injuries really do leave behind different kinds of ruins. Now, the collapse of even one building in our cellular city does not go unnoticed. So now we're going to zoom out from that local disaster site and look at the citywide emergency response, the body's red alert. And that red alert has a name you definitely know: inflammation. This is the body's emergency services rushing to the scene. And they have a 3-part mission. First, neutralize whatever caused the injury. Second, clear out all the rubble from the dead cells, and third, lay the groundwork for rebuilding. And the signs that these emergency services have arrived have been known for thousands of years, first described way back in ancient Rome. These are the 5 cardinal signs of inflammation, and you know them well. You've got redness from blood rushing to the area, swelling as fluid leaks in to help out, heat from all that extra blood flow, pain, which is your body's way of saying, hey, protect this spot, and finally, loss of function, which is basically putting that part on mandatory bed rest. These 5 signs mean healing has begun.
So this is a really, really important takeaway. We tend to think of inflammation, the redness, the swelling, the pain, as the problem itself. But it's not. It's the visible evidence of the solution. It's your body's highly organized, absolutely essential healing process kicking into gear. It's the cleanup crew and the construction team arriving on site, ready to work.
So, the emergency is being handled. The cleanup has started. What's left behind? Let's move into the final phase of our story, the aftermath, and the long-term scars of this cellular battle. Sometimes the situation gets a little more complicated. If that dead necrotic tissue, all that rubble, gets invaded by the wrong kind of bacteria, it can lead to a really dangerous condition called gangrene. This is basically like squatters moving into that condemned building and starting to cause a whole new set of problems for the entire neighborhood. And just like necrosis, gangrene isn't a one-size-fits-all problem. You can have dry gangrene, which often happens in places with poor blood supply, like your toes. It tends to develop slowly. On the flip side, you have moist gangrene, which can happen in tissues that are still full of blood and fluid. This makes it a much more dangerous and rapidly spreading situation, often seen after a severe traumatic injury. Now, assuming things don't get as bad as gangrene, the body has a whole toolkit for dealing with the wreckage. So what does it do? Well, sometimes it can just liquefy all the debris and haul it away. Other times, if it can't be removed, the body will just build a wall around it, encapsulate it to keep it contained. The most common solution, though, is to just replace the damaged area with simple scar tissue. And in a few very special cases, the original tissue can actually regenerate completely, as if nothing ever even happened. And there you have it. We've just followed the entire chain reaction, from one single invisible cell getting hurt to that injury becoming permanent, which leads to the microscopic rubble of necrosis, which then triggers the body's very visible inflammatory response, and finally results in the outcome we can actually see and feel, whether that's a simple scar or something far more serious. It's really an incredible story, isn't it? A story of disaster and response, of damage and repair, all of it playing out on a scale that's almost too small to imagine. It just goes to show you that every single thing that goes wrong in our bodies, from a common cold to a complex disease, is telling a story that's written in the universal language of cells. The only question left is, what story should we try to decipher next?